This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. No tests found. That's the message you'll get if you try to book a walk-in or drive-in COVID test online in London. We know because the Evening Standard tried every one of the city's 32 boroughs. Meanwhile, the number of cases recorded in the UK went up to 4,000 yesterday. The Prime Minister admits the testing system has huge problems. Our editorial column wants something done about it.
It's imperative that people who fear they have COVID symptoms are able to be checked as quickly as possible. In the absence of a vaccine, that's the only effective way to stop infections spreading. The Prime Minister says that schools shouldn't send whole classes or pupil bubbles home unless a child has had a positive test. But how on earth can this work if there's nowhere for them to be tested? It's a shambles. The principal cause of this mess is, of course, organisational and administrative failure by the government and those tasked with delivering the system. But what's not helping either is the lack of clear, consistent messaging from ministers. The prospect of a second national lockdown, which must be avoided if possible, was being quashed today by ministers. But if London and the country as a whole is to overcome the current spike in infections and prevent further restrictions, the government, from the Prime Minister down, must end the testing chaos and get a grip of its message too.
Our reporter Rachael Burford spent the last couple of days researching this and she's with me now. Rachael, you tried them all, every borough in the city. What happened?
So yesterday we spent about 5 hours or so trying to book a test everywhere in London using a residential postcode for each borough, and there was none available anywhere. We weren't even being redirected yesterday to tests outside of London. It was simply there are no tests available. Check back later, which we did, and then still no test available. So,
and again this morning as well.
Yeah, again this morning there was apparently sort of 18 available for a walk-in centre in Kensington, but again when we tried to book that, there was the slots for booking never actually came up.
And this really is just exposing how difficult this crisis is, particularly as we have a situation where, you know, the Prime Minister has said that children shouldn't be taken out of school unless their entire bubble is without a test, but now parents can't get a test. You spoke to a parent, didn't you, Rachel? What kind of trouble were they having?
Yeah, I spoke to quite a few parents. There's a couple quoted in the story. They had to go on huge round trips, 3 hours to Epsom. One parent I spoke to had to do just to get a test, and they were, setting alarms for midnight, waking up, refreshing the government page for days to get a test. Others that we spoke to had actually just bitten the bullet and paid for a private test, which cost over £100, just so they can get their kids back to school and they don't have to self-isolate for 2 weeks. And I think the thing is as well, kids, especially young kids, they get ill all the time, and they've constantly got colds and coughs and things like that. So a lot of the tests, people have got results back. Their tests have been negative, but they can't risk it, and they have to take the time off work, which has a huge sort of impact on their income as well for a lot of people. It's just a huge disparity across the UK as well. So we tried to book a test in Scotland, putting in Scottish postcodes, and there's ones available immediately. Go and get one in half an hour in sort of Aberdeen, Dundee. That's all fine, but trying to get one in London is just impossible.
And is there anything being done about it? I hear there might be a new rationing system put in place.
Yeah, so they're talking about, it's going to be announced today that there's going to be a rationing system where key workers, teachers, NHS workers, care workers, they will get priority for tests, which, can only be a good thing, but there are so many key workers, huge amounts of people that work for the NHS and, teaching, schools, and there are so many occupations covered by the key worker status that there's still going to be a huge number of people needing tests all the time. Especially a lot of them will have children who will come home and be ill, and then their whole household will need a test. So, hopefully it will help, but we don't know yet.
So what's the Department of Health saying about all this?
The Department of Health are saying, they're adding tests all the time. They've got 200,000 tests a day. But when you speak to actual people, there is no one I spoke to that said, yeah, I was able to just go and get a test. It was so easy in the last 2 weeks. I mean, before children started back at school, yes, it was easier to get a test. But now that the children have started back at school, it's just very, very difficult, especially in the capital.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.